we had made a decision, especially because of my kidneys, that we wouldn't let it climb very high. We would be very proactive. So by the time my M spike was 0.4, we decided that we would start therapy again. In the meantime, I was also able to come off of dialysis just by a fluke. My catheter quit working, my dialysis catheter quit working, and we removed it and decided to wait and see how long I could go without dialysis. And my kidney function was probably 13% at the time. And over the course of 6 months, maybe I might have been up to 14%, 15%, and I was managing. So now my kidney function is anywhere from 20 to 25%. It usually is in the 20-21% range right now. I've been off of dialysis for 7 years, and so about the time I stopped dialysis in October of 2013, almost 2 years exactly since I had started it. By December of 2013, we saw my M spike go up to 0.3, and then at that point I was only going quarterly to be checked. So then we started going monthly just to keep an eye on it. When we got to 0.4, we made the decision to start treatment again. And still, the only real maintenance therapy, the commonly used, was Revlimid. And we're not a research center here with My Cancer Institute. And other than what I was reading and researching on my own, wasn't looking at clinical trials or anything like that. But so those are the two options, was basically Revlimid, possibly Velcade. And I'd only been on the Velcade for 4 cycles, which is really only 2 months, and I had no side effects from it. So I asked my doctor, is there any reason why we can't go on Velcade again? And cost was a huge deal too, because Velcade is a treatment, so your insurance treats it differently than Revlimid as a prescription drug, and Revlimid's very expensive. So my doctor said, yeah, I think we can get that approved as maintenance. So April of 2014, I started Velcade treatment to get my numbers back down. And I did it 3 weeks on, 1 week off. And we kept doing that. I started seeing a specialist in September of 2014 at Duke University. One of my sons was living in North Carolina, and we thought, well, we'll go see a specialist, one of the top specialists there, and we can, visit our son. And she recommended that I stay on the Velcade 3 weeks on, 1 week off, just to keep my light chains down and keep my kappa lambda ratio in the normal range, or get it in the normal range, because that will help my kidneys. So instead of lessening my Velcade, I stayed on 3 weeks on, 1 week off for over 6 years, and just kept on that regimen. It was if it ain't broke, don't fix it. And again, 6 years with no neuropathy, really no side effects other than maybe chemo brain. And so anyways, my numbers eventually start climbing again, and I have to look at new treatment or doing something different. We knew the Velcade would only go so long, and I was lucky to have gotten the 6 years out of it.